Hi there, Mike here from Levack Physiotherapy. Today's video is on the old physiotherapy staple, heat and ice. So, heat and ice are the simplest, cheapest and best ways of accelerating the healing process right from the first moment of an injury. However, often it is misunderstood and misused, and rather than helping the situation, actually hinders it. So, when do we use which one and why? So, ice is primarily used to constrict blood vessels, and that squeezes out the inflammatory fluid from an injured area. Inflammation is good, it has a job to do. However, the quicker you get rid of it, the better. This is because true effective healing cannot start until the inflammatory fluid has been dispersed. So, after an injury, directly afterwards, when things are swollen or getting swollen, this is when you ice an area. For no more than 20 minutes at a time, covered in a towel, then leave a good half an hour between icing sessions. This icing will also help quite substantially with the pain relief. For injuries that have been around for more than a few days, or weeks, or months, or years, what you need to be thinking about is how does it feel at the painful or injured area. If something is hot to touch, or is constantly throbbing or aching, then you have inflammation. It may not look particularly swollen and you may not have experienced a sudden injury happen, but it's inflamed. This is an important time to ice too. Heat will always feel nice. Heat is nice, it's warm, warm is nice. Cold is cold, cold doesn't feel so nice. But heating will only exacerbate the problem, either prolonging it or making it more painful in the subsequent hours due to more fluid rushing to that area. In that sense, ice is a bit of a necessary evil. It's not super nice to use, but the effects are incredible. So, heat. Everybody's favorite because it feels so nice. It relaxes the muscle, helps loosen tissues, and eases the pain sensation. Heat causes blood to rush to an area in order to absorb the heat so it can be dispersed elsewhere around the body. Now, this is good because it helps bring the essential nutrients to the injured site and helps remove all the waste products, accelerating the healing process. This is especially necessary in less vascular tissues such as tendons and ligaments when they have been injured. So, when do we use heat? We should be using heat on an area where you've had an injury, but the swelling has subsided in order to improve the rate of healing at that area. Also on areas of abnormal tension or tightness, where you may be getting just sharp little twinges of pain, as opposed to aching and throbbing. That's when we would use ice. Again, we only want to be using it for 20 minutes maximum, and then leaving a good 30 minutes in between sessions to let all the tissues relax and recover from that session. There are, however, situations where you will use heat and ice in combinations. These vary depending on the injury or condition you may have, but definitely not within that 24-48 hours after an injury, or if an area is hot or swollen or really throbbing. Just ice in those situations. So, in basic terms, we warm up, we exercise, we cool down. Simple as that, just like PE at school. Pre-exercise regime, you want to warm things up, loosen off the tissues, lubricate the joints, gets blood into the area, then perform your tasks or exercises. Then afterwards, you ice things, cool things down, get rid of any inflammation caused by the tasks, and then get rid of the waste products. In chronic pain conditions or chronic injuries, you treat your day like this too. Warm it up in the morning, get things loose with whatever exercise you've been prescribed. Then in the evening, once the day is done, ice and remove any inflammation before you rest up at night. This can help reduce the stiffness that can build up overnight as a direct result of the inflammatory fluid and waste products settling within the tissues overnight. So, obviously, every injury and every person is different, but these are the very, very basic principles for most injuries that you want to be following. All right.